All right, so now we're going to go ahead and load the pictures onto the computer. So we're going to go ahead and get the little SD card out, and you're going to need a card reader. You'll pop that in there. And one of the best things you can do is go ahead and store this onto your server. So if you can have your IT guy make you a little file, and notice that on our computer, on our desktop there, we have a file there called Visual that's basically a shortcut to all the places that we store pictures. So on the third one there, we have a file called All Patient Photos. Now let's go ahead and show how we would create a file. So we're going to have Kristen right click and go ahead and go hit New Folder, click on the folder, and there it pops up there, and then she's just going to put in our patient's name, Sarah Shofu, we're going to call her, and then open that up, and she'll go back to the other screen, which was essentially where the images were stored. And now she can go ahead and grab all these pictures at once, scroll all the way down. She's going to select them all, and copy them or cut them and paste them in. And at this point, all the pictures will be there for your viewing. So again, I highly recommend that you take these pictures, store them onto your server, make sure you have a good system in place to get that server backed up so that you will be able to have a place where you can view them on any computer. Also, if we're calling this by the patient's name, if you do work on this patient, you'll have a file based on your provisionals and your post-ops, and pretty soon you're going to have just a vast library of cases that you can look to help get better, but also for marketing and showing other patients what's the potential. So that's all that is required. So let's go ahead and enter the pictures into the Dawson Diagnostic Wizard. And again, what we highly recommend is to go ahead and do your examination. When you're doing your examination on the patient, enter that data right into the wizard as you're doing it. And at the same point, we're going to go ahead and load the photographs. So we have other places where you can learn about this, but let's just focus on the photos for now. And notice how she's basically clicking on the photo tab. And essentially what we can do now is it's just a matter of dragging and dropping. So if she goes ahead and grabs the full face that she wants and pulls it over, she can get the profile picture in position. And again, if you have a second monitor, this makes it even easier. Is that it's just a simple matter of grabbing the pictures and dropping them into position. And so if you are even shooting these pictures in order, you can drop them in all at one time, and that's really a slick thing to do. But we just a matter of scrolling down and getting the key shots, dropping them into the position, and then what we'll do later is go through and talk about what we're looking at on each specific picture to help us with our treatment planning modalities. So what we're getting a good look at here already is notice how level these pictures are. There are no cants. Remember, however those teeth are hanging in the patient's head, we want to see that. So if everything is nice and level, that should be how things are viewed. I see a lot of cases where the head is turned, or we see cants, or you're shooting from underneath. And the way that we have avoided that in this case is that we had the patient positioned properly, we had the doctor positioned properly, and we are using a camera, a very easy camera that allows us to have a proper exposure, a proper f-stop, and a proper lens setting. And so it pretty much takes the assistant about 3 or 4 minutes to drop these in. And if this happens on the day that we do our examination, when I come back or when we come back to do our treatment planning, we'll be ready to roll.